Lisa, did you want to record on Loom too?
Yep.
Yeah. Okay. Go on.
All right. Welcome, everybody. This is our Empowerment Through Movement lecture. Today will be really fun. We're going to kind of go into the positive effect or positive impact on exercise for just increasing like your self-perception, your self-worth, your self-concept, and how physical pain is showing up to actually help us and what we can learn from it. Mhm. Okay, I'm actually not recording, so one second. Okay, we're good. Okay, so everyone's heard about the mind-body connection. It's kind of like a big word in the health and fitness industry. And what this information that we're sharing with you today does is it really takes it to the next level. Okay, it shows us that the psyche, brain, and organs being tissues as well, are all operating as one harmonious unit. Okay, so symptoms, all symptoms, unless they're caused by a poisoning or a blunt trauma, are triggered by conflict shocks. Okay, so conflict shocks are events that are isolating, emotionally distressing, and unexpected. Okay, so they have to follow these three criteria in order to cause change at the tissue level. So it goes psyche, brain, tissue. The tissue will adapt in order to help you survive. Okay, so whatever you're dealing with, whether that be, shocking news, a loss, feeling unworthy in a situation, that will trigger an adaptation. Okay. So again, all symptoms are intelligent adaptations to help us support survival. Today, we'll just be covering physical pain, but this does apply to all symptoms, which is super cool. And I love this stuff if you know me. The type of conflict shock will determine the affected part of the brain. So you can see here in this little diagram, you can see this is the brain. This is the cerebral medulla. This is the part of the brain that is impacted by self-devaluation conflicts. Okay, so it affects the muscles, bones, and connective tissue. Okay, and there'll actually be like a lesion. If you were to do a brain scan, a CT without a contrast, there would actually be a lesion on that part of your brain. Super cool. Okay, so today our mission is to explain these processes, how movement can empower healing and balance, and to reinforce positive self-talk, our favorite, to show how everything is happening for us. And we'll even go into some of like your specific pain symptoms, and kind of like Sherlock those for you.
So what is a self-devaluation conflict? So a self-devaluation conflict is anything that involves self-perception. So if you're feeling less than or unworthy, and again, like Lisa said, it is a isolated event where you felt this. And it's often related to failing expectations, comparisons, or even just a loss of recognition or ability. So something that might trigger that is being rejected by a potential partner, a parent or a friend, even losing a job or failing in some sort of career ambition. So anything that you're self-imposing that you have failed or that you've compared yourself and you're feeling unworthy of.
Yeah. And the whole purpose of like why the tissue changes on the like organ or tissue level is in order to heal stronger. Okay, so there's actually something called the surplus group that gets built. I like to call it luxury group. But the whole point is because during the conflict active phase, so when you are experiencing that unworthiness or you are comparing or you're like feeling dumb, for example, there's cell loss at the tissue level or osteolysis if it's bone, whatever it is in the affected tissue. And then once that situation, so you're, for example, like once you resolve that situation in the healing phase, the body starts to repair that tissue, and that is when you start to experience pain. And that resolution can be, say you lost your job and you're feeling inadequate or, not worthy, and then you got a job and then you start to get the pain. That is a super common scenario. Yeah, that book, What to Say When You Talk to Yourself. You might have
I did.
gotten
read that
that.
one. I did read
I'm
that.
gonna mute someone. You might have heard that suggestion from us before, what to say when you talk to yourself. And we'll go into that a little bit more towards the end of this lecture, just about just why that really is so important and helpful to speak loving to yourself. Any questions so far on the self-devaluation conflict? No. The next slide is an example, just showing you like a chart of what's actually happening. So conflict active phase, so feeling unworthy, feeling rejected by your partner, just lost your job or failing in your career ambition. This is where you're getting cell loss. So the bone or the muscle or the ligaments are breaking down here. Okay. And then resolution happens, and that pushes you into the right side of our screen. And that's the healing phase. So this is when the tissue is being repaired. And this is when you're inflamed, you're feeling pain, and the body is telling you to chill out and rest while it works to make you stronger. Now, what can happen, and this is something that we see frequently, is you can kind of become stuck in this loop, and they call this a hanging healing. So when you enter the healing phase and you start to feel that pain, this is super common. I want you to listen to this. You start to feel that pain and you start to feel inadequate in that part of your body. So for example, you get knee pain, okay? And you're actually healing, but you're talking to yourself like, oh my gosh, like I'm not going to be able to do what I normally do. Like I can't, do my leg extensions at the gym. I can't PR. Like I'm not going to be able to, so you start to have like that vicious cycle of negative self-talk, which makes sense though, right? Because you're like, okay, you're nervous, but that's actually going to shunt you right back into the left side of our screen, into that conflict active phase. So you're kind of so again, this vicious cycle, you're stuck in a hanging healing because you're re-triggering the same conflict happening again. So when you understand this, you can kind of have some peace around it, like, okay, I am healing. Thank you, knee. Thank you, body. Thank you, pain. I know you're building to become stronger. You're creating that luxury group for me. So thank you, thank you, thank you. So yeah, does that make sense? Yeah.
Just add on to, this is typically where you'll see people with arthritis because they're in this constant hanging healing of a tissue trying to break down and then repair. So the fluid just accumulates and you never actually get a full healing or resolution. So if, people who have chronic arthritis or joint pain, this is typically where it stems from.
Yeah. Or like saying I'm old. Oh, I'm just old. I'm just old. Like I'm not going to be able to do what I used to be able to. Again, it's how the symptoms become chronic. Okay, many of you know Dr. Gabor Mate. We really like this quote by him. Disease is not a punishment or an accident, but it's a signal that has meaning. It is a way of dealing with life events and changes. So the knowledge that we're teaching you is Germanic healing knowledge, German new medicine. Like it's founded by Dr. Hammer, and he really took what, leaders like Dr. Gabor Mate are speaking about, and he's giving us like the science of it, which is really cool. So yeah, just more opportunities for learning, and just showing us that our body is smart and working for us.
So perception. So another quote that we love by Dwayne, when you change the way you look at things, the things you look at change. So perception is everything when it comes to German new medicine, Germanic healing knowledge, and conflicts in general. And as we know, perception is just how one interprets a situation. And this is often influenced by your past experience, any expectations you might have, and of course, like many other contextual factors. But here's just a few examples of how perception plays a role in these particular situations. So romantic relationships. So if you're feeling inadequate or unworthy after a breakup or rejection, you're going to perceive that maybe differently than how your partner would. But again, this is why two people can experience the same event, but the outcome be very differently, both physically and mentally. Same with work or school. So experiencing self-doubt, diminished confidence after critical feedback. Some people might take that as growth. And then some people might turn inwards and say, like, I'm not good enough, or I kind of failed to meet the expectation. And then that kind of goes into setbacks and failures. So just believing you're not capable or deserving of success after experiencing some sort of setback, comparing yourself to others. So some people might use this as like a growth opportunity to kind of push themselves a little bit, but then some people might also look at it very unfavorably, leading to feelings of like inferiority or just feeling kind of down on yourself well, you compare it to others. And then past rejection, so just feeling insecure or unworthy, love, acceptance, or just whatever, just due to past experiences. And again, there's so many other examples, but these are just kind of the main ones that you typically see when it does come to someone perceiving a situation differently.
Yeah, that's awesome. And another example, sorry, somebody raised their hand, so I'm just seeing if they actually want to speak. You can speak if you want to speak.
That was me. Hi.
Hi.
I am thinking about like conflicts or maybe wounds that happen when we're kids and
Mhm.
like have like a through line into our adulthood. And I'm like, is that also what you would consider a hanging healing, or how does that like resolve itself um if it was something that started years and years and years ago?
Yeah, it's something called tracks.
Hmm.
Kelly, you want to speak on tracks?
Yeah, so tractors, anything, you can kind of think of it like a scab. So anytime, if you have a wound that's healing and then you fall again and you rip the scab off, it's never fully coming to a healing phase. So like kids who like pick their mosquito bites, your parents are always like stop picking, it's not going to heal. So you're probably getting re-triggered by other things that were there during the initial conflict. So if it
Reminding
was,
you of it.
yeah, so if it was like a conversation per se, and you were eating a particular food, your
Peanut
psyche,
butter sandwich. This is where allergies happen.
yeah.
Hmm.
So your
Sorry.
psyche will interpret everything during the active conflict and kind of take a snapshot. So anytime any of those elements might be present again down the road, you're going to be re-triggered or that track is going to be kind of activated.
Hmm. And this will be again, this will be like scope of like another lecture, but this would be like also allergies. This is why people have like seasonal allergies. It's not necessarily the pollen. It's like things around that time that is taking them back to a certain event that happened during that time. So
Hmm.
yeah.
Okay.
Mhm.
Thank you.
No worries. Okay, I found these Maryland picks. I don't even know where I found them on the weekend, but I love them. Yeah, this is just a Bruce Lipton quote we like, just reinforcing what we're talking about. The moment you change your perception is the moment you rewrite the chemistry of your body. He's the best. I like him a lot.
Yeah.
On podcasts, he's good. He's cute.
So this kind of brings us up to what are you telling yourself? So during these difficult times or just potential conflicts, like what are you internally telling your psyche or your body? So is it that you're embarrassed, that you're weak, that you're too old? And how can we kind of reverse this or change this to be more self-loving so we can actually avoid getting these painful kind of tissue breakdowns? So these are kind of the negative ones, but maybe there's a way that we can kind of reframe some of the ones that you are telling yourself to be more positive and loving.
Yeah, and just bringing it back, I know we talk about this a lot, and especially when we have like Jody on our calls, but just going back to awareness, like how are you speaking to yourself? Are you speaking loving? Because it does not serve you to speak negatively at all. Mhm. Okay, I get this question a lot. So how do I know if it's a conflict versus an actual injury? So an injury is going to be like a blunt trauma, being in an accident, being hit by a person or an object. Um, it's not going to be a functional, it's not going to be a functional movement. So it's not going to be like bending over to grab something, and all of a sudden like slipping a disc. There is a reason why that tissue has become weak in the first place. It's not just random. Okay, so there is a reason why that particular area, whether it's your back, your thoracic spine, your lumbar spine, it has weakened, has been breaking down over the last however long. It means you are conflict active. So going back to that chart, that is where that tissue breakdown is happening. Does that make sense for everyone? Any questions? Yeah.
And because there is no pain in the conflict active phase, and you only get it once you enter that resolution or that healing phase, you won't even know that that tissue has been breaking down. So you'll think that you just, oh, I just tweaked my back, but that
Mhm.
tissue's actually been actively breaking down for a while. And you just probably weren't aware of it, and you had a resolution. And now, because the tissue is so weak,
Mhm.
it will take slim to nothing to probably feel some pain.
Yeah. And this is where treatment is really confusing too, right? Because people, they resolve the conflict, they're actually in healing, and they're running around trying to figure out what's wrong. So it's keeping them in that loop of being like, oh my God, something's wrong with me. I'm not good enough. Like I'm, literally re-triggering those self-devaluation conflicts. Once you have this awareness around this, it makes such a difference. Okay, bone and muscular pain index. So self-devaluation conflicts, there's different severity levels. So a light self-devaluation conflict, so like minimal, like light, will affect the connective tissue, cartilage, tendons, lymph nodes, and vessels. A moderate self-devaluation conflict will affect the muscle, and then a severe self-devaluation conflict will be bone. Okay, this is like much more severe. And just going back to like perception is everything. So there's not like a list of, which situations are, light versus severe. And actually, like before we started this lecture, Haley and I were just like talking about we're talking about like examples of this. And what actually came up was my mom had like really, really bad gnawing bone pain. And that was after, which is similar to Haley, like they went through chemo and they lost their hair. And I don't know if everyone knows that Haley went through chemo, trooper, but had really bad gnawing pain from that, from her hair loss, and like her value of herself had diminished. That was her perception though, just from that. Whereas Haley's perception of, losing her hair was like, okay, which wig do I get? Like, and she was like excited about the type of wig that she got to wear, which is just obviously very, very different. I thought that was cute and funny.
Yeah. And like Elisa said, the severity is just determined by your perception. So if you're kind of looking at it more positively, or you have a different perception of how that situation is, then you might not even have any self-evaluation conflict at all. Or it could be light, and then Elisa could have severe, and we go through the exact same conversation or same conflict. So
Mhm. Queen. Okay, biological handedness. So this is very cool. So if you know for sure you're right or left-handed, because not everybody actually is, because some people do actually end up switching for convenience sake. So this applies to where you're experiencing pain, like which side of the body you're experiencing pain, and who the conflict can be. What am I trying to say here, Haley? Who it's like related to or with. So if you're right-handed and you're experiencing symptoms on your right side, that is going to be more partner related conflicts. And then the left side will be mother-child conflicts. And then if you're left-handed, it's going to be opposite. So the right side would be more mother-child conflicts, and the left side will be partner. And it's important to note that mother-child conflicts are going to involve obviously mother or child, but it's anyone that you nurture or care give. So this could be pets. This could be a grandparent or parent that becomes like a child to you. And it could be even like a business baby. Okay, wherever you're like having like that maternal role. And then partner conflicts is basically going to be anything aside from what you're providing a maternal role to. So partner, obviously, maybe a business partner, a friend, yeah, a dad.
yeah, siblings.
Siblings, yes. Yeah, friends.
And if you don't know if you're right or left-handed, and again, this is different from the actual hand that you write with. If you do the clap test, so when you clap, whatever hand is on top is typically your dominant hand. So when I clap, my right hand's on top. I also do write with my right hand, but it might be different for others. So if you clap and your left ends up on top, you're probably left hand dominant. Okay, so there is a muscular index in terms of the area in which you devalue yourself will show up in different parts of your body. So if you have low back pain, for example. That could be some sort of support conflict. So somewhere where you feel unsupported or that you haven't been able to support. What's another one? Shoulder. Shoulder is very typical as well. A lot of people get bad shoulder pain. So this could be relationship self-evaluation. So again, not feeling worthy in your relationship or feeling like you've let someone down. Your hip, so just inability to endure a situation. So usually
Lots of
push,
hip. Lots of
yeah,
hip.
lots of hip. So inability to kind of just kind of be present in that situation or be the person that needs to be. So again, just
Able
feeling
to
like
like push through, like able to
push
like
through. Yeah.
persevere really
Yeah.
through a really tough time.
So
Hmm.
we recommend taking a screenshot of this because obviously you're not going to memorize it, but it's kind of just a good little map in terms of like if you're feeling pain in any of these areas, can you look at the conflicts and questions associated and just say like, did I recently go through something that might affect or that might be tied to kind of enduring a situation and not being able to withstand it?
Yeah, does anybody want to write their I mean, we'll go into the questions on the next slide, but if anybody wants to like drop their pain symptoms, we can kind of go into them because it'll be a lot to go through all of them. But if you want to write like elbow, shoulder, anything like that, we can ask you some questions to kind of get clear on what's going on.
Yeah.
I know somebody has pain.
Mhm.
Left lateral knee. Selena, you're right-handed, right? Shoulder, neck. Yeah. Okay, so knee is going to be performance related. So anything where I see this in a lot of athletes, super common. Physical performance self-evaluation. So where do you feel you're not strong enough? Again, so this is where you can kind of get stuck into that loop. So if you're feeling the pain and then you're feeling like you're not strong enough or you're not able to perform like you normally would if you didn't have that pain, that can keep you stuck there. So affirmations, again, going back to thanking your body is going to be really, really helpful here. And also too, I think like resting, a lot of people don't actually rest when they have pain. Pain is a sign that your body is healing and it needs rest to repair. You have some shoulder in there?
There, yeah.
Shoulder, neck, upper back. Okay, neck. Neck can be one of two things. Neck, I get neck, right neck. Neck can be in like an injustice situation. So like somewhere where you felt that you were in like the situation was unjust. Or it can be intellectual self-devaluation conflicts. So if you felt dumb, if you felt stupid, that's going to correlate there. Low
Yeah.
back support conflicts. Where do you feel unsupported? Where do you feel like you can't give enough support that you wanted to give?
I think Lindsay said TMJ and jaw. So that's a good one too. I feel like a lot of people experience that, but don't really like people who grind their teeth and they have jaw pain. It's typically associated to someone that you've wanted to bite. So that could be figuratively or literally. So wanting to snap back and maybe not being able to. So whether that be because it's in a work situation, or just a professional setting and you know that you can't snap back at someone. So like wanting to yell at a boss, or it could be your kids. But just knowing like you had to like bite your tongue. So that feeling of like having to bite your tongue, or kind of just like keep your words in, that's going to manifest into some sort of like jaw or teeth pain.
Yeah. And what you can do actually, like something physically that you can do with the bite conflict. So if you're having jaw pain and you're feeling like you want to say something, but you can't, sorry, I don't know why my alarm's going on. You want to say something and you can't necessarily say it, go speak it into an apple or something hard and crunchy and like actually say the things that you want to say as you're biting into the thing. Yeah. Okay. Verity. Mine started when I found out my partner had cheated on me, betrayal, still working on it 20 years later. Yeah. The thing is though, like when you understand this, I mean, that's like, we're not immune to conflicts. Like we're still going to experience life and things are still going to happen that we have to work through. And there are opportunities, right? But when we understand this, it can help us prevent the hanging healing situation from happening. So like for Selena, like her knees, knowing that her knees are perfectly fine, they're actually going to heal stronger. You always heal stronger if you don't interrupt the healing phase. Okay, so if you like let it be and just understand that, that's the best thing you can do. So you can actually just downgrade everything. Left SI joint, I am right-handed. Left SI would be not partner, would be mother, it would be mother or child. So something that you feel like you can't give support to, or you feel unsupported in relation to those relationships. Give a thumbs up if you can think of something. Left hip, Lindsay, not being able to endure something. You're right-handed, right? Yeah. Not being able to endure something with like your mother, or you don't have any pets, so I don't think it would be a pet.
Hip can also be like something that's felt too heavy, or you
Mhm.
kind of felt like helpless,
Mhm.
just overwhelming responsibility.
Grief comes up
Grief,
a lot.
yeah,
Awesome one, yeah, because that's like hard to endure, right?
yeah. Anyone who's like gone for like a hip replacement or something like that, it's typically been like a long standing, maybe stressful job, stressful project, stressful relationship.
Mhm.
You've just felt like you haven't maybe met the standard. That's going to be like continuously breaking down those tissues in the hip joint itself. And then eventually you do get to a point, if you're in this constant like hanging healing, where you are not able to reverse it because the tissues are so broken down. So that's why
Mhm.
people do go for hip replacements or knee replacements, because it really is just bone on bone and the actual tissue is no longer there.
Yeah.
But again, that's why it's always older people. It's not people who are like usually 20, because the conflicts haven't been existing that long. So yeah, it's kind of. So have
Mhm.
any of you kind of experienced injuries and now look at these and can connect the conflict to the injury? You don't have to come off mute, but you can just kind of internalize and again, like
Elizabeth,
agree
I want to
to.
talk about my clogged duct.
Oh yeah. Yeah, it's just an example of it. Go ahead.
Yeah, it's crazy. So I've like breastfeeding gotten a clogged duct a couple times now. And I think naturally when it happens and you're a first time breastfeeder, you get really scared and fearful that you're going to get mastitis, which then it's an infection, there's a fever, and it's very painful. And even just having a clogged duct is really painful. So the first time I had it, I was literally so scared. And I was like, oh my God, this is going to get so bad. I'm so scared. How am I going to take care of the baby? I'm going to get an infection and all this stuff, spiraling. Um, Now this was my third time it's happened. And ever since the first one, I started to kind of calm down, but also think, okay, like why is this happening? What's coming up? I'm right-handed. It's coming up on the right side. Every single time my breast has clogged has been due to me and my partner resolving a conflict, just like natural things that have been coming up, learning how to be with one another now with a baby. But literally within 2 hours of him and I kind of just resolving our conflict and talking, I got a clogged duct. So it's really great being able to honestly use these examples, because I was able to just kind of calm myself down. Like, okay, it's fine. I'm not going to get an infection. It's not going to lead to mastitis. I'm going to just stay calm, ice it, hold my baby, let my baby milk more from it, and it's going to unclog. 24 hours, not even done. I
See,
swear.
it's the downgrading. If you can self-soothe, that's everything.
Yeah. Yeah.
And
Mhm.
not jump to conclusions.
Mhm.
That's the
Yeah,
other thing.
I got rocked with my low back remember last spring, and we had a presentation, and I remember the conflict that caused it. It was like, yeah, it was a support conflict with my partner, and I literally couldn't even move. And I just remember being like, hey, I'm just gonna be horizontal and sit through this pain for as long as possible. Um, and it was gone within like if honestly, I think when I first started getting back pain, like when I was younger, I remember being like, am I ever going to be able to walk again? Like the severity of the pain is so crazy, can be so crazy. And then when I got it last time, I was able to just like calm myself down, no big deal, not calling everyone, and just like completely, bye, Christina, and just chilled out in bed for 24 hours and I was back to it. Like it was no big deal afterward. And I've been fine since. Yeah, take a screenshot if you guys want of this one too.
So just
Take-
reminding yourself that pain is not a bad thing. It's actually a good thing. It means that you're already healing. And just reassuring yourself that your body has everything it needs to heal. So just be patient. I know it can be frustrating. We've all had injuries that are beyond frustrating and you feel very limited, but just changing your perception of it and allowing yourself to do what it needs is all you can do.
Yeah, and a note on painkillers as well. Obviously some of us have to do life sometimes and like we need painkillers or whatever it is to get through the day when we're experiencing pain or symptoms. But if you can avoid taking it, then it's actually going to shorten the duration of your healing phase because taking anything like that, like medications, can actually delay, like it lengthens the healing process or like dampens it, if you will.
So now, how do we resolve these? So there's really 6 steps in order to come to a full healing if you are still not conflict active, or if you're someone who's in a hanging healing. So step 1, just recognizing and acknowledging that symptoms are these biological adaptations. Your body is not broken. It's just reacting to the experiences that you've gone through. And then 2, just realizing and connecting your specific symptoms to a specific conflict. So can you actually recall or realize that there was a conflict that you went through that has now manifested into this pain? And then recalling, so kind of similar. So just identifying that exact moment or event where you self-devalued yourself and then start to kind of look at it and reframe how it could have gone differently. So that's kind of what brings us into realize. So just focusing on letting go of those old decisions. So any self-limiting beliefs that you had in that situation, just that might actually be fueling the conflict. And I always like to say, so make the unconscious conscious. So anything that might not be conscious at the moment because it's just kind of packed away deep down, make that conscious and realize that it's kind of outdated and that your perception no longer serves you. So just letting go of anything that might be kind of keeping you in that kind of self-devalued state. And this is where we can now replace it with a new self-concept. So actively kind of reshape what you are telling yourself, just your self-identity, your self-worth, and then just start introducing positive affirmations and beliefs. So again, this is where like Elisa and Jody too, if you've been on any of her calls, kind of start to come with like the journaling and just really start to kind of create your own script. So not necessarily confining to what you might have previously been telling yourself, but how can we kind of start to rewrite that story? And reclaim. So understanding just that healing involves more than just eliminating symptoms. Symptoms are not a bad thing. It's just telling us something that we need to maybe look a little bit deeper on. And then just reaffirm that kind of what you are experiencing is okay. And that you are now kind of rewriting that script. So these are kind of the 6 main steps that you have to kind of work through in order to achieve that kind of healing state and stop the
cycle, the vicious cycle.
Yeah.
Or the severity, really, right? Because again, we're going to experience conflicts, but the severity, our perception we can downgrade our perception of it, right? 4, 5, and 6, we should make them pink because they're really related to how strength training can benefit us, right? Like release. Who has cried at the gym? Yeah. So that's just there, letting go. And then replace and reclaim all. You can experience all of these with your strength training, which takes us into the next slide, all of the other benefits of it. So we get the endorphin release, neuroplasticity, stress reduction, improvement in body image. So again, that self-concept, which is so, so important because it makes you more resistant strength training makes you more resistant to conflicts because you have more self, like a higher self-concept, more self-worth, a better body image. Really, like how many of you, like since starting this program or, you know, treating, like going through this process have been saying like, you know, you're loving your body now and all of these things. It's so, so, so important. It's so good. It's a good coping mechanism. Social support and connection, also huge. Feeling like you belong. Cognitive benefits. And yeah. So again, the exercise, the strength training in particular boost self-worth, resilience, well-being, mitigating the root cause of most self-devaluation conflicts. And at the very least, it reduces the severity of them.
Not only can we like prevent them, we can also downgrade them if you are currently experiencing them. So yeah, it's kind of
just don't do this if you're actually in a healing phase.
Yeah.
No strength training if you're in pain.
But listening to your body. And I think this, I know Elisa posted something on this earlier, but we love the pain after a hard workout. So those symptoms are very similar to the same symptoms we have when our muscles are breaking down from a conflict.
Yeah.
And we have to treat them in the same way. So just kind of using this as a mechanism to,
Yeah. Like what if you just like loved your, like try and love your pain? Like just like your post-workout when your butt's sore, you done, you know, you did like some heavy hip thrust and you're like, okay, you know, my butt hurts. It makes sense. Same thing. It's
Yeah.
rebuilding stronger if you allow it, if you don't get in the way, right? Nature knows what to do. We are the variable in how nature can, like we're the variable in creation, right? Creation knows what to do. Nature does not make mistakes, but when we try and get in the way or when we accidentally get in the way, that's when we can not have resolution.
This brings us to our level of consciousness. So healing involves moving through these levels of consciousness. So you can't actually heal or grow from a place of guilt and shame. It's literally impossible. So by removing those self-limiting beliefs that are keeping you in those kind of lower levels of like guilt, shame, grief, actually allow you to work up the ranks and kind of reduce that fear and self-awareness so that you can achieve a more aligned level of consciousness. And yeah, as you kind of move up, it provides you just with more opportunities for growth and self-awareness. And this kind of goes to everything that we say at FHK about self-love and coming from a place of love. It's really because if you're consciously in a place of self-love, that's where transformations can happen. They can't happen from those lower levels of force. So I don't know if you want to add anything to that, Elisa, but
Yeah, no, it's it. You can't heal or grow from a place of shame or guilt. Just like you can't change your body, or at least sustainably and healthfully, from these lower levels. So removing self-limiting beliefs, fear, and having self-awareness, you can work up to the levels of the more aligned levels and just feel better. Also too, like your wounds and your pain, like it says that already, invitations for healing, but really they're opportunities for you to grow. And when you grow, your perspective widens, which more opportunities for light. And then when you hold more light, you share that with others. And then you also can, you know, when you learn from your opportunities or from your pain, you can help others as well, which is cool. And I know everyone here who's done the program and has friends, you're like helping your friends with what you've been learning, and that's all part of it. Sharing light. Any questions? I hope you guys learned something.
I hope you're.
Yeah, go ahead.
So when we're in the healing phase, which is when we're actually experiencing the pain, right?
Yeah.
If we try to do things to speed up the healing process, are we then interfering, like, warm compresses or like
Oh, okay.
stretches or things like that? Like, is that affecting us, or should we just like let it do what it needs to do and like just step back?
There's a difference between supporting healing and then interfering. So
Okay.
something like a warm compress, if it's a skin thing like jojoba oil or something that's supportive. But
Okay.
something like medication, anything that's not natural, you can kind of think of it that way. Would you say that that would make sense, Haley? Anything not
Yeah.
natural is going to be interfering. So things like going to physio and osteo, those things are all supportive. Those are good. Eating high quality nutrition, supportive.
Okay.
Yeah.
Okay, so we're not completely like just throwing our hands in the air. We can like,
No.
okay, got you.
Yeah. As long as you're not like the whole point is just to make sure that you're still speaking loving to yourself and you're not thinking, okay, because I have pain, something is wrong. Nothing is wrong with you.
Right.
It's adapting and it's gonna heal stronger.
Thank you.
And sometimes too, like if the injury is severe enough, medication or some sort of relief will be
Yeah.
probably necessary just to take the inflammation out, because there will be such an enormous amount. So any sort of relief that you can get in those moments, you're gonna want, which is totally fine. But it's just being aware that your body is actually actively trying to heal, and then incorporating things like mobility, like rolling, hot compresses, anything like that is like really good and supportive, and like chiro, physio, doing those stretches, not just going to physio and then not doing the stretches. Actually doing them,
Guilty.
your homework. But yeah.
Yeah. Good question. Anybody else? No, that's it. All right. Well, thank you guys so much for coming. Oh yeah, Jody said my fave soothe. I am safe. Yes, so good.
You said, did you want to touch on the self-love
Oh
work
yeah.
too?
Yes.
A couple minutes.
Self-love challenge starting February 1st. So we will be giving in the community, we'll be giving away for participation, which we are going to send through what's involved for participation with the self-love challenge. It's just going to basically be like posting some of your meals, posting some of your workouts throughout the month. We'll be giving away a free month of coaching or for a free cycle, 4 weeks, to the winner. And yeah, it's gonna be a lot of fun. We're gonna keep each other accountable and motivated for the month. And yeah, it's a short month, 28 days. So
Yeah.
Mhm.
And if you have any friends who have wanted to try out FHK,
Mhm.
they posted it today, but it's $28 for the month. And it's
$1 a day, $20, 28 days.
So they'll get access to the community for the 28 days, or like a subset of the community with specific targets, and then a training program for the 28 days. So if they ever wanted to just kind of see what it's all about, it's a great time to share with them. And yeah.
Yeah, definitely. We appreciate you sharing so much. And if you guys have any questions, let us know. If you get any pain come up in the next week or so, we hope that you can take some of these things and downgrade it. All right. Talk to you guys later.
Bye, guys.